Very good evening to all of you. We are live from Medicover Hospital, Visakhapatnam. I'm Dr. Dalai, Chief of Neurovascular Intervention. We have a 75-year middle-aged man who is having recurrent stroke in the left side of his brain because of a critical stenosis on the carotid artery. The carotid artery means heart nunchi brain varaku vellaniki blood vessels undi. So there are two major blood vessels which are going from the heart into the brain. They are called carotid artery. So there is one carotid artery on the right side, one on the left side, which goes and divides into internal carotid artery going into brain, external carotid artery going into the face. Now for our gentleman today, left side carotid artery 99% stenosis అయిపోయింది, చాలా సన్నగా అయింది. So let's look at the angiogram that is already done. So ఇది carotid artery. Can you just reduce the size a little bit, demag a bit? So this is the common carotid artery which is coming from the heart, which is on the left side. So two carotid artery, one on the right, one on the left. This is the left carotid artery which divides into two. One is going into the face, which is looking okay. One is going inside the brain. You see that it has become very, very narrow, and there is a little bit of dilatation, and this has become very narrow. This is in fact going inside the brain, and because the blood vessel has become so thin, the reduced blood supply is causing hemodynamic stroke on this patient. So ilaga treatment avutundi, ilaga carotid artery disease ki rendu rakala treatment avutundi. Okate open surgery chesi ఈ క్లాట్ తీయడానికి ఒక ప్రక్రియ ఉంది, which is called a carotid and arteriectomy. And another procedure, operation లేకుండా, we will go inside from the neck, and from the groin we are going today. We can also go from the radial artery from the hand. We'll go to the neck and we will do an angioplasty, put a stent, and we will improve the caliber of the blood vessel and hence preventing the recurrent TIA or stroke. So let us see how we do this procedure today live. Thank you so much. So with me we have Dr. Vinay, my good friend. He's a neurosurgeon working with us in Medicover Hospital, and we have Parvati, the eternal beauty, and we have Prasad, and we have a smart boy, Tarun, the smart boy, and the smart Sinu, which is behind the camera helping us. And we have Gauri. Where is Gauri? So we are trying to access the left carotid artery. Yesterday we did a super major case where we have to do a penetration of 4 vessels. So we are accessing the left carotid artery. So we had a young man yesterday who had a thoraco-abdominal aortic aneurysm, and we did a 4-vessel penetration and endovascular grafting. अच्छा थोड़ा एलियो दिखा, एलियो 30, table please, mag, Colmate side, table please, perfect. So you can see very, very well now. We did an angiogram which is showing absolutely thinned out blood vessel. Almost we would say it as a 99% stenosis. Can we go with an F6? So how do we do this procedure safely? We try to navigate one umbrella-like device that is called a filter, which is placed distally in the brain. Brain nopulki ఒకటి umbrella లాగా device పెడతారు, so that angioplasty చేసిన టైంలో suppose any clot goes from the level of the carotid, then clot will be caught with the umbrella. So here we are using a NAV6 embossing from about. There are multiple devices available to us. It can be a spider, which can be a angioguard, it is going to be tricky, so don't expect it to be straightforward because it's very, very critical. Carotid artery diseases are fairly common, and it is one of the common procedures that we do. Am I happening given?
Given, sir.
There is dichotomy.
No.
One brilliant.
One brilliant and two.
One brilliant one dichotomy there. Can I have the top? So we might have a little bit of struggle here to negotiate. We have to be very, very gentle not to dislodge any clot. Yes, it is so tight that I am even having resistance pushing the wire up. So you can be, you should have a lot of patience to go around this. Maybe so that's not the one. Don't move here. Go back. So we could manage to cross, thank God. So the filter wire, the umbrella device, distal embolic protection return key, this has gone up which is a very important step in the whole procedure. Scroll में पाओ बेटा.
We'll give the
Yeah, Brenta question दे दो बेटा. 1 tablet, 90 mg. Brenta 1 ecosprin 150 mg even.
Sir, no. Tablet చేసుకో.
So you could realize it was really, a tricky situation to go through this artery, which was really, really critically narrowed, and we just crossed the lesion. And we have taken our distal embolic protection here, nerve 6 from above, which we will deploy into the distal right now, just below the picture segment of our ICA, and then we will see how we go about the study. So let us deploy the distal embolic protection here. You can see this umbrella is going to open. So it just opened, you can see. Not completely because the vessel is very small, but that's okay for us. There it is. So now you see that. So this is the delivery of the nerve 6. This is the nerve 6 distal and proximal. And this is an angiogram which is showing us that, see, this IC is completely occluded with this simple distal embolic protection going in. That critical is the narrowing. You can see the umbrella device is opened up and everything looks okay. So far so good. Can I have a balloon? 520, yeah. So yesterday we were doing this thoracoabdominal, as I was saying, almost like from 10 in the morning till 6 in the evening, because 4 vessels has to be fenestrated, the celiac, the SMA, bilateral renal, and that is on a thoracic graft, and then you have a triple act, and this patient also had an iliac aneurysm. Everything was fixed, and thankfully by grace of Almighty today the patient is doing well and having food out of anesthesia. Super excited about that. Now, yeah. So Dr. Vinay, what are the causes of carotid artery disease? Yeah. So we see a lot carotid artery disease in India, because probably the cause of this high number of carotid artery disease that we have because of atherosclerosis, because of the diabetic population that we have. So we call it as a diabetic capital of the world, India. And diabetes causes accelerated atherosclerosis, and atherosclerosis causes occlusion or the stenosis of this carotid artery because of these atherosclerotic lesions. Take please. 1 minute. So Parvati, what you had for lunch? Wankai. So what is this? Give. 1 apple. So multimally ఒక patient ki stroke అవుతుంది means you should think that the patient can have carotid artery, which can be carotid artery disease, which can be treated. Stroke avdaniki, what are the signs and symptoms? Basically the symptoms of stroke is very easy to remember. We call it as a FAST, F-A-S-T, FAST. F for facial weakness, A for arm weakness, S for sit down, speech weakness, and T for time to rush to the hospital. So ఏం చెప్తాను నేను, స్ట్రోక్ అవడానికి ఒక పేషెంట్కి స్ట్రోక్ అవడానికి సిమ్టమ్స్ ఏంటి? సో టు రిమెంబర్, ఒక పేషెంట్కి స్ట్రోక్ అవుతుంది to remember this, you should remember FAST, F-A-S-T. And now we call it as a B-FAST, B-E-F-A-S-T. F means facial weakness. ఒక పేషెంట్ who was otherwise fine suddenly ఒక side face ఒక side bend అయిపోతుంది. A for arm weakness. FAST. F for facial weakness. A for arm weakness. Suddenly ఒక పేషెంట్ కి ఒక సైడ్ వీక్ అయిపోతుంది, పక్షవాతం. S for speech. ఒక పేషెంట్ who was fine suddenly ఒక మాట్లాడేకి డిఫికల్టీ అవుతుంది, లేకపోతే మాట్లాడే పూర్తిగా స్టాప్ అయిపోతుంది. So then you should think of a situation that the patient is having stroke. Now we have added B first, B and E. B means loss of balance. A patient who was normally able to walk suddenly upside fall అయిపోతుంది. And E for eye symptoms, sudden blindness, sudden blurring of the vision, that can also be a stroke. So these are the symptoms of stroke. ఈ స్ట్రోక్ సిమ్టమ్ ఉంటే ఇప్పుడు చాలా చాలా బాగా ట్రీట్మెంట్ ఉంది. లైక్ అక్యూట్ స్ట్రోక్ పేషెంట్కి మెకానికల్ థ్రోంబెక్టమీ, ఎంటీ, చాలా మంచి ట్రీట్మెంట్. సో యూ గాట్ అ గుడ్ ఓపెనింగ్ ఆఫ్ ద రైట్ సైడ్. నౌ యూ కెన్ సీ ద ఫ్లో ఇస్ బీన్ ఎస్టాబ్లిష్డ్. అండ్ ఒక స్ట్రోక్ పేషెంట్కి ఇవాల్యుయేషన్ చేసి carotid artery disease ఉందా లేదా చూసి we should be able to address if there is such a disease which is critical and significant. So Dr. Sujit was there yesterday for the case thoracoabdominal. Dr. Sujit, what is your experience on carotid artery disease? You can see that it's a beautiful carotid artery. Here it is a critical stenosis. Now with the balloon angioplasty, you see that the blood flow has improved dramatically. We can put a stent and create a vessel which will be more permanent. So ilaga patient ki what is the anesthetic requirement? Carotid artery disease stenting cheyadaniki time lo labate oka endarterectomy chesina time lo, what are the things that you are looking for?
Definitely, if patient is comfortable, we will allow the patient to be awake, and so that we can assess the sensorium and neurological balance while during the procedure. But sometimes if GCS is low, or if patient neurologically is before the procedure itself is not of good GCS, then we need to secure the airway, and in those cases we will be intubated and sedated.
So we have taken a stent which will be exact 6/8/40. So we can see very well that the restoring the caliber of the vessel is impressive. So far, can you just talk about it? So carotid endarterectomy, carotid artery stenting, medical management, these are the different type of treatment that is available to us to address this patient needs. What do we call that?
This one.
Next frame, next frame. Yeah. So we have aligned our stent in the vessel in that area where that is diseased. That's most important. So we are opening the stent here, and that's deployed. You can see that the stent is deployed, yeah, with some residual stenosis. Brought back out. the stent is there, the distal embolic protection is there, which we will show you. Prasad, can you show the distal embolic protection? You can see the stent here and Pina చూపించండి. So you see the umbrella here. So when we are putting a stent, our distal embolic protection, the filter is there so that any clot, any emboli going from this area will be caught here. So you are giving absolutely good protection. Table please. Perfect. Now you can see the stent, you can see the filter. Can I go to that building? Now let's look at the angiogram. How it looks like after the stent. It's beautiful. It's beautiful. So we might just try to improve a little bit, not much, because we have achieved whatever we want to achieve. And this is a self-expandable stent. That means it will try to take the shape and size of the vessel. We don't really have to do much, but a little bit of post-stent angioplasty. Generally, it should be avoided in many cases. Because we have a distal embolic protection, we can do it. Because the most chance of distal embolus is because of a post-stent angioplasty. Deflate out. So gentle inflation, which is perfectly okay for us. Just gentle, yeah. That's what. Once more. Deflect. Up. So we have done gentle inflation. How is the patient, Dr. Sujit?
Yeah, he's comfortable, sir. నాలుగు బయట చూపించండి. నాలుగు బయట చూపించండి.
So the best thing is patient is conscious quietly, and we can talk, we can discuss, we can find out what is happening. So as Dr. Sujit, our chief of cardiac anesthesia, has already described, they prefer it to be under local anesthesia so that they can do a neurological monitoring very easily. Beautiful. So we can remove this embolic protection. So we are trying to catch the umbrella with the clot that it might have taken it in, and we are taking it out. We can show you the umbrella here. Dr. Vinay, can you show the distal embolic protection and nav 6? You see this? There's not much, but there are microembolus which are at the top, which could be prevented. That's a good thing about. So whenever we do carotid artery stenting, it is mandatory that you see the cerebral circulation before and after the stenting. Reduce the mag once. Mag ఒక తక్కువ చేయండి. So you can see that there's a little bit of spasm, but otherwise it's okay. This spasm will go on in about 2 to 3 minutes. So nothing to worry. Epicranial, cerebral. Cover the head, yeah. So you can see that the flow has started into the cerebral circulation ladder. Cover the head. You can see the cerebral circulation, everything. Stent, magnet. So because we have to do an angioplasty because into a distal stent, so there is cerebral spasm which will settle down in time. One more mat, table. Table. Yeah. You can see the entire stent here. That's perfect. So you can see stent flowing up and going into the cerebral circulation. Can you cover everything? Stent and the brain? Full DMAC. Yeah. So this will give us a clear picture how things looks like at this point of time.
Yeah.
This is perfect. You're happy? Yeah.
Good, sir.
So this is how we did a carotid artery stenting in a very critically stenosed carotid artery with distal embolic protection. Thank you so much for joining us for this live case of carotid artery stenting. We will see you next again sometime soon. Thank you.